Hi, welcome to my channel, All About Nursing. Here we discuss everything nursing. Today's topic is the nursing report. What is the nursing report? Why is it so important? The nursing report is the handover process of pertinent patient information from nurse to nurse. And it can happen at shift change, it can happen at admission to a unit, transfer to a unit, transfer to the operating room, transfer from the operating room, but it goes staff to staff, nurse to nurse. Okay? So when we give this information, this is to ensure we have continuity of safe patient care. There are a few things that are important during nursing report. In this video, we will discuss them. Nursing report. Today our patient, as we said before, his name is Dave Ken. This is us going to discuss Mr. Dave Ken and what is important in that report to give to the nurse. So let's dive in. So we start off with the basics. What is our patient's name? Mr. Dave Ken. How old is our patient? He's 38 years old. We give over the patient's allergies. This is to ensure safe practice. He is allergic to penicillin. He is in room 101. Our patient is on full code. His attending is ABC. And what are his injuries? He had a left femur fracture. He had a right humerus fracture. A right hemothorax. What is his isolation status? He's on standard precautions. So he can be on airborne precautions. He can be on droplet precautions. He can be on standard precautions. Our patient is on standard precautions. What is his safety risk? Safety is alarm, bed alarm set. He's a fall risk. What is his past medical history? He is hypertensive, anemia, anxiety with IV drug abuse. Also, our patient has a past surgical history because he had some injuries. He had surgery. He had ORIF of the right humerus. Today is post-op day 1. He had hemiangioplasty of the left femur. Today is post-op day 2. So the nurse is already aware now of this patient's baseline with regards to his basic information and what was done for his injuries. Now we go to the systems. We have to cover the entire body systems, all of them when we give report, so that the nurse knows the patient's baseline upon receiving this patient. CNS, Central Nervous System. He is alert and oriented times 3 with a glass GCS of 14/15. So this patient is confused. So the nurse would know the patient is confused. His respiratory status. This patient had a right hemothorax. So we need to know what is his respiratory status. He is on oxygen at 3 liters via nasal cannula. He's at 96%. And his chest tube is underwater seal drainage. And he has clear diminished braces chest auscultation. So that means when the nurse listened to his chest, she heard diminished basis. She had assessed diminished basis, and the patient has an underwater seal chest tube drainage. His musculoskeletal system, what's going on there? So he's on a non-weight bearing to the right arm. Weight bearing is tolerated to bilateral lower extremities. So we know now that he can actually stand, and he's not to put any weight on that right arm. His skin, we need to let the nurse know about his skin. Skin assessment is a very big deal at hospitals, so that has to be very thorough. So skin assessment, he has multiple abrasions. It's scattered on his skin. He has a 20 gauge IV to his left hand, and he has dressings by 2 to one his right arm and one his left femur. Well, that was expected because he had surgery, but you still need to let the nurse know that he has 2 dressings, okay? Now, what was his cardiovascular system? His cardiovascular system, is he on telemetry? Yes. Our patient is on a sinus rhythm. That's his rhythm. His telestrip shows he's a sinus rhythm right now. his pulses are all intact, and he was given 4 units of blood. 4 units of packed red blood cells was transfused. And he's currently having Ringer's lactate 125 mils per hour. So we know now how we are managing his circulatory system. Now, this patient has intake and output, which is his gastrointestinal system and his genitourinary system. So his intake was 1500 mils. His output was 2200 mils of urine continent void. He has a chest tube with 200 mils of output. He had 1 bowel movement, soft, formed, and brown. He is on a regular diet. That sounds normal to me, but I'm happy to know that as well, so I can manage my patient properly. Neurovascularly, what is his neurovascular status? So in neurovascular, we assess your strengths and your pulses. So this patient has, on his right upper arm, we will assess 1 pulse, and it was weak on the right upper arm. His left upper arm was moderate, pulse was 3. His right lower extremity was strong, and his pulse was 3. And his lower left extremity is weak with a pulse of 2. So this is all the systems of this patient here that we have covered. So the nurse now has an entire systematic assessment of this patient. So now we get to the plan of care and what is currently happening now. So this patient plan of care is for daily chest x-rays. Now the nurse would know the reason we are doing this is because he has a chest tube, underwater seal drainage. He is to be mobilized daily. She already knows how we can mobilize. He is on CWAP protocol. What is CWAP protocol? This is for withdrawal. So we know he uses IV drug abuse. Also, we know that with CWAP protocol, there's a reason. So this patient, his blood results, his urine came up, his urine fentanyl was positive, cocaine was positive, and he was 170 in his alcohol test. So they are assessing him to make sure that we could be on top of any signs of withdrawal. But so far he's at 4, so he's been doing fine. His WBC is 17.1, his HB is 9.6, and his CRP is 6. Sodium and potassium are normal. Okay? So now we go to the medication slide. So this patient is on cefazolin 2 grams IV, and it was last given at 6 a.m. He was also given Percocet 2 tabs Q4 hourly, which was also given at 6 a.m. Because patient will be having pain, so you need to know what pain medications he's on. He was also given hydromorphone 1 milligram IV every 4 hours. This was given at 6:45 after the Percocet medication. This was given because when she assessed the patient again for pain, the patient was still in pain after getting the Percocet. So she had to give the medication at 6:45. Also, this patient is to be given, so she's going to tell you what he's going to get. This patient is going to be receiving iron at 9 a.m. and ibuprofen at 9 a.m. So you have a holistic screen here of everything that this patient is getting managed with, what happened in the past, and what we're doing going forward. This way, the nurse has a thorough idea. She has all the information that is relevant to managing this patient. So when you give a report that is thorough like that, and a nurse can answer questions, and she would know if this patient is for surgery. For example, our patient in this case study, he is for daily chest x-rays. She already knows that. This patient has a chest tube. She already knows that. So when she goes in to manage her patient, she knows that she has to manage these things following protocol. But if you do not tell her, she will not know. If you do not tell her the patient is non-weight bearing on the right arm, how will she know to educate the patient to ensure the patient doesn't put weight on that right arm? Or even anyone that goes in, a family member might be trying to get him to get out of bed. She will be able to guide the patient. Guys, remember, we don't like having horrible shifts. We don't like getting a horrible report. We feel like we were cheated if someone doesn't give us a proper nursing report. Let's make sure and give a thorough report to our colleagues. Always remember, nurses do it better. So we must hold ourselves to that standard that we do it better. We are the best and we save lives. We are the eyes and the ears on the floor to pick up any abnormalities, any changes in status, And the only way we can do that is if we get a baseline at every shift change, at every changeover of patient care. So let's continue giving up all this great care to our patients and making a difference in the world. And remember, nurses rock, and don't forget to look out for more videos all about nursing.